Thank you very much, Madam Chair. And Governor Pawlenty, you proposed a path to universal coverage rather than universal coverage. Could you elaborate on why in your state you decided the more incremental approach?
Yes, we're pretty far along the continuum, as I mentioned already, at 7% uninsured, 93% insured. And so as we looked at the various models that have been proposed either academically or on the ground around the country, we think we can make very substantial progress beyond even 95% with the types of payment reforms that I've suggested in my earlier comments. And then we're going to harvest part of the savings from those payment reforms and plow it back into an existing or style of program that we have in Minnesota, provide more access to the uninsured. We hope that most of the savings, in my view about 2/3 of it, will go into holding down premiums and then some more for access. In my opinion, you've got to be careful about a mandate where you say everybody has to be insured, and then if you the health care that you have available in your marketplace isn't affordable, you end up criminalizing poor people or penalizing poor people. So I think a better approach, and we think we can get there without such a mandate, would be to do the payment reform and provide the ability for individuals to go into the marketplace and purchase it themselves or through their employer or associations.
Thank you. And in your written testimony, you had emphasized that states should continue to have the flexibility to try new approaches. Could you discuss why that's so important?
Well, we celebrate this year the 100th anniversary of the National Governors Association, and one of the roles that we think we can play is to be laboratories of democracy, that we can go out, try new things. We're a little smaller, we're a little more nimble, we can do things a little quicker. The good news is if we can show that it works, you could perhaps take some comfort as a Congress before you took it national without having to take on all the risk. On the other hand, if we do things that don't work and they turn out to be stupid, then you could prevent that from being visited upon the whole country before we road test it a little bit in the state. So having flexibility, first of all, respects federalism, respects state rights, and that's the tradition of our country. But second of all, it preserves this role as a laboratory of democracy where we can be experimenters and hopefully deliver results that might be appealing to you.
Thank you. And finally, in your written testimony also, you referred to making consumers meaningful partners in their health care. Could you discuss why that is so important?
Yeah, well, it's been my experience, sir, and I'm sure it's been yours, where when people have some skin in the game, and I don't mean that medically, I mean that financially, they tend to behave differently. And if I go out in the hallway here and have a cardiac arrest, I don't have the time to look up, who the best local provider is in terms of a quality website and look up price transparency. But for those things that are schedulable, predictable, preventable, and repetitive, it seems to me having consumers' interests financially aligned with best price, best quality is a good thing to do. And the good news there is, in our research, in most instances, the highest quality providers, in many cases, are also lower cost providers. Not in all cases, but in many cases. And so this investment of consumers changes their behaviors in ways that I think will serve the financial systems well, but more importantly, will also drive them to better health care.
Thank you very much, Governor. I yield back the balance of my time, Madam Chair.
Sure.